Over the last 24 hours, we have identified 1,857 new cases of COVID-19 and completed about 17,500 tests. Our positivity rate currently stands at 10.7%. These are concerning numbers that underline the fact that we have work to do together. We have identified 1,326 additional cases of variants of concern in the last 24 hours. Variants currently represent about 60% of our active cases. I also must report that we have now confirmed the first case in Alberta of the B.1.617 variant, first identified in Denmark. It's also been found in California and is a key driver in the rise of rapidly spreading cases that we are seeing in India. This variant was in a returning interprovincial traveler to Alberta, and no additional cases of this variant have been detected to date. As with all new variants, research is underway to understand what may be different about the B.1.617 variant, how it spreads, and if it creates more severe illness. So far, we are calling this a variant of interest as we work with colleagues across the country to monitor the latest findings on this variant as evidence emerges from around the world. There are now active alerts or outbreaks in 612 schools, which represents 25% of the schools across the province. A total of 3,502 cases have been linked to these schools since January 11th. Today, Edmonton Public and Catholic school boards moved grades 7 to 12 online for 2 weeks. Consistent in the approach in both Calgary and Fort McMurray, when they shifted these students to online learning, all extracurricular, youth sport, recreational, and performance activities for these ages are now required to either take place outdoors or be paused in Edmonton. This requirement will stay in place for the same 2-week period to assist in slowing down transmission in this population. There are now 518 people in hospital being treated for COVID-19, including 116 in the ICU. It's important to remember that hospitalizations are a lagging indicator, and these individuals in hospital were likely first infected around 2 to 3 weeks ago. Given how high our leading indicators, growth rate, new cases, and positivity rate have been, we can expect to see this number grow in the coming days. We must bend this curve down to prevent these severe outcomes and the subsequent impact on our healthcare system. Sadly, I must announce that 6 new deaths were reported to Alberta Health in the last 24 hours. In the last 24 hours, more than 42,300 doses of COVID-19 vaccine were administered in Alberta. As you know, in order to make these doses count as much as possible in combating the spread of COVID-19, our second dose interval aligns with national recommendations to extend up to 4 months. Having said that, we have continuously been reviewing emerging research, and today we are making a slight change in how we approach second doses for select populations who may not respond effectively to their first dose. Effective tomorrow, those in Alberta who are undergoing specific kinds of cancer treatments or who are on other medication that results in a level of profound immune compromise will be able to book a second dose 21 to 28 days after their first. This aligns with Ontario's approach and is specifically limited to Albertans who have received solid organ or stem cell transplants or who are currently undergoing specific immune compromising treatments such as chemotherapy. This will also apply to individuals being treated with an anti-CD20 monoclonal antibody such as rituximab. To be clear, this timeline applies to these individuals only due to their extremely weakened immune system. Also aligning with Ontario, anyone receiving solely hormonal therapy, radiation therapy, or surgical intervention for cancer, or other therapies that are not as profoundly immune compromising, will continue to receive their second dose at an extended interval no later than 4 months after the first. Again, these levels are concerning. We certainly need to be responding as we are with as fast a vaccine rollout as we can have. with the measures that we are putting in place, again, those that are province-wide that were put in place 2 weeks ago, as you say, as well as targeted measures, ensuring that where we are seeing spread in school-aged children that is disrupting the operations of schools, that we're making sure that the measures put in place to limit transmission within those age groups, that we are adding to that by restricting the interactions of individuals in those particular age groups indoors for the length of time that school in person is paused. And the need for any additional measures, again, is being discussed, looking at the data and multiple factors that weigh into that decision.